Okay, and we are live. Good morning, everybody, and welcome, Matt. Excited about this conversation. Thank you for taking the time to speak with us. I know we've been working together for a while now on this Salesforce journey. You've been working prior to that on the CM journey. So, welcome. Maybe for just for the Accelirate channel viewers and folks that are watching and will watch later, but perhaps if you can just start with a little bit of an introduction of yourself, and then we'll get into the business.
Sure. And Shahzad, thank you very much for inviting me to participate. It's a great privilege to be here today, and so I think both highly of Salesforce and your team and what you've been able to accomplish. So a little bit of my background. I've got 40 years overall IT experience. I've been in kind of every role of IT. There has been from a junior developer on up to CIO to consultant to kind of make it happen person. I have, I'll say, an extensive history of cloud, you would call cloud nowadays, but I was involved in cloud before it was cloud. And then obviously integration space and making, enabling business solutions and making sure that business is always the driver and making, listening, having IT listen to the business and listen to the clinicals and listen to what people really need versus saying, here's a widget, go deal with it. So I have a long background of that, of kind of the working through the meeting point between IT,
Hmm.
business areas,
Hmm. Hmm.
and what's possible.
Yeah, and I've seen that, in your style of work. I think that's one of the reasons why we've had the fun conversations that you and I have had.
Mm-hmm.
I think we share that kind of philosophy of solve the business problem. Don't lead with technology. Yes, of course, it's a phenomenal, catalyst, and it's what you build the solution on. But it's really about solving that business problem. So let's start there then. So maybe start with, just help us first understand what is ClinNexus's mission, what is the vision, and what is enhanced care management. I actually had some of the folks that we sent the invite out to, and they were like enhanced care management. So perhaps start with ClinNexus and enhanced care management, Matt.
Well, why don't we start with enhanced care management since that's
Sure,
kind of the topic of the day, and I
sure,
think that
sure.
because the two kind of dovetail around each other. So, enhanced care management, everybody's familiar in the healthcare space with chronic care management, as well as
Hmm.
transitions of care from, if you're leaving the hospital or if you're leaving a nursing facility where you're going to next, and chronic care where you're dealing with continuous issues that need clinical attention over extended periods of time. Enhanced care management, the state of California is really leading here in a unique way.
Hmm.
People have been
Hmm.
talking about enhanced care management, which is really trying to connect to the patient, or in certain populations, they're targeting young pregnant women, homeless, certain Latino populations, and as well as other populations in California, and they're really trying to help make sure that they are being connected to the healthcare organizations and healthcare solutions.
Hmm.
And as we know, typically with all the traditional healthcare environments, a lot of times you go into a doctor's office or you're talking to a payer. You're involved in a transaction. You're involved in an activity. You're involved in trying to execute a claim, or you're trying to make sure that somebody's got their medications, have access to medications. It's very
Hmm.
kind of, I'll say, targeted, functional. But there's not a lot of connectivity about talking with the person. Is, do they understand what they're doing? What's happening? Are they able to really understand why they're doing certain things? And yes, the clinicians are very forthcoming and talking to us as patients about, what what is the objective. But then once they walk out of the room, it's kind of, they kind of lose track of that. The patients do a lot of times.
Hmm.
So there's been some recent articles and other publications that talk about the clinical teams have, about a 20% impact on people's lives. The 80%, from SDOH and other kind of outside factors are really driving a lot of these conditions more so than what the clinical teams can provide. So enhanced
Hmm.
care is really trying to make sure that people have access to where they might have housing issues, or they need to go to the food bank, or they might need to go to a smoking cessation. So it's really trying to look at the person versus trying to saying which ICD-10 transaction do they fall into, or which other condition do they fall into. So that's kind of the nuance of enhanced care management, at least in the state of California to begin with. And we think California is leading the charge here, like they have in so many other topics. And so ClinNexus, in kind of an analogous situation, we have been focusing on trying to enable care coordination fundamentally. We started off in the transitions of care area. So when people leave the hospital and then move to either their home or a nursing facility or other kind of location, helping them do that. And everybody agrees the first 30 days when you transition off of a hospital stay, that's the important things to avoid those readmission activities. Yeah. And so we spent a lot of time in that space, and we've also spent a fair amount of time in this ECM space. And now we're kind of trying to be the glue that connects all the dots together. So all these traditional healthcare activities. And then the other component that the state of California has amplified is there's community services and community outreach functions that can deliver services. So like I mentioned before about the food bank or housing assistance programs or smoking cessation scenarios, they really want, they being the state of California, really wants for the people of California that need these kinds of services to be connected to not just the traditional healthcare world, but also to these organizations, and then make sure that it's happening too. Part of this, as we've seen over and time again with patients/members, is that are they actually implementing what's been asked of them? Are they actually doing it? And it's hard. It's difficult. It's not something simple. So we're just trying to be the glue that connects to the patient, follows up with the patient, follows up with the community services, and follows up with the traditional healthcare organizations, just to make sure things are happening, and then stay connected with the patient kind of throughout that process to see what kind of questions, things they're dealing with on a regular basis. So let's not wait for the problem. Let's connect with them, every periodic time, whatever that means. And it does vary by the clinical condition scenario. So that's what ClinNexus is really about, is trying to provide this care coordination and having kind of both a virtual level services as well as an in-person where necessary. So we're trying to make sure we connect to the people and not lose sight that it's about the people ultimately.
Yeah, so thank you for that. It sounds like it's very holistic, right? And the vision is grand, if I may. And if I tie that back now to the challenge, that is, how do you kind of put the technology together? So when you mentioned, for instance, things like community centers and food banks and smoking, all these other, let's call them third party or external, like anything that's outside the hospital or like a clinical setting, right? Of course, not everyone uses the same technology. Not everyone has the same knowledge of technology. Not everyone has the same level of motivation to work with technology. So there's a lot of challenges that are beyond, I'm going to drop in an EMR or an EHR, right? And the magic of technology will just work its way out. So how do you, so as the kind of the visionary for the technology behind this process, how do you think about selecting a platform or picking, however you make those decisions on how do I put something like this together? What's your thought process, Matt?
Yeah, thanks for the question. We actually did spend some time talking about this, and we spent time. We intentionally did not go pick a platform and then go figure out a business answer. Okay, we intentionally spent several months, actually years, working as a team, working the clinical problem, working in clinical definition, and I was a part of that process. And so we stayed away from trying to We say in the motion that the business and clinical teams are the reasons we exist, and that IT is an enabler of that function. So we want to maintain that kind of core foundation of thinking. And then you add on top of that the wanting to focus on the business solution and spend our money. And so, it all comes back to how much you're going to spend, where you're going to spend it, how you're going to execute as an IT leader. Where we wanted to make sure we spent our funds in the area of enabling the business or clinical teams. We wanted to minimize the spend on kind of core traditional IT activities and support services and all the other aspects that you typically get into when you're running an IT department. So we really wanted to really kind of make sure that we're seeing results more quickly on the business side than trying to go build a platform ourselves.
So when you talk about enablement as opposed to some of the other things, are we talking about doing like quick, rapid prototypes? Are we talking about platforms or pieces of functionality where you put these kind of built prototypes, if I may, in front of the clinicians to kind of get feedback from them so that the rollout process is easier? I want to get down like next level of what does it mean to be selective in terms of what you're actually focusing in terms of the spend itself.
Okay. Yes, I would say it's some of the prototyping is everything, but I would say that we're kind of in a new area with this ECM topic, and on care service, because there's a lot of history in provider management and as well as in the payer teams about managing their own organizations and the workflows within those organizations. That's a well-known trail. Now that we're trying to, all those organizations are trying to reach beyond their borders now, and we're trying to, like I said, live between all of those borders. And in doing so, we wanted to recognize that we don't have well-honed workflows. Okay, and that starting with something that's already kind of pre-established and pre-built, i.e. Health Cloud, helps us say, okay, we don't need to think about all the patient demographics. They have it. They've got 80% there. Let's try to solve the 80% question before we're trying to solve the 20% question. And so in doing so, we are kind of doing rapid prototyping. We are doing several things where we're kind of making decisions around care coordination. And again, back to the patient itself. What's the patient experience in this? What's the clinician experience? What's the provider or payer experience in this? So we need to think of kind of everybody's experience in this, but in doing so, what's the data and enabling functions to drive all that? And so there becomes a fair amount of communication requirements, really, when it comes down to it.
Yeah.
And that's where Salesforce Foundation beyond Health Cloud is really, the traditional CRM side of it is really as meaningful as it is the Health Cloud side of it.
Okay, yeah. So I think we can transition over into that, kind of process of what made sense to you when you started looking at Health Cloud, for instance. But when you talk about living in between borders, and if I may, Salesforce being the passport that allows you to go across these borders, or the highway that lets you, kind of get that communication flowing, right? Maybe talk about the 2, 3, 5, with the kind of the most important things that you said, because it can do this is what we're going to build on.
Well, it gave me us a solution day one that we could turn up without having to go build a lot of new solution for. So there's been a lot of history already built into it. So we just wanted to leverage those efforts and thinking. Again, we asked the question, are we unique? And we're not. Okay, we don't, from a general healthcare perspective, we're not that unique. We still see patients. We're still trying to communicate with people on a regular basis. We're trying to communicate with these different organizations. So that being kind of the fundamental aspect of need, led us to kind of Health Cloud, and I'll say what I call the pliability of Health Cloud, where
Mhm.
you can take an existing field or an existing process and do simple adjustments, and then present that to the clinical team to say, here's what we're doing in these situations, or to the business teams dealing with all the business different organizations, and generally having that kind of flexibility and pliability easily and quickly is really the essential thing.
Yeah, again, I mean, I was, it's been fun working with you directly. I don't get to work with everybody, but I think this has been a fun exercise where we've looked at what is native to the platform, and then we've looked at these very detailed documents that you and your team produce, and see where that kind of marriage is in terms of, well, this is what Salesforce does out of the box. I think one of the last things that you and I talked about were these care plans, for instance, and how we took
Yes.
one of the constructs from ClinNexus and we mapped it to care plans, and it just beautifully just kind of came together. And of course, we're going to go down that road of kind of leveraging. So I think one thing that gives in from this side of the border, if I may, Matt, I think my view into is that being open and accepting is also a part of your success in terms of, hey, how does Health Cloud, the kind of the native platform, does functionality XYZ, and then
Mm-hmm.
we look at it, right? We kind of do a little, well, this is how this is supposed to work, and then you say, well, in my construct, 80%, like you're saying, it's the 80-20, like this is how we do it. Let's map it to the functionality. So I think that also is a major kind of contributing factor to the speed of your success, right?
Yeah.
The kind of the rapid speed with which you guys were able to make the progress. I was there in the demo when we had like 5 or 6 very senior doctors, and they went, whoa, they were really excited to look at all the relationships in one place, all the activities in one place, the patient data that you guys had put together. So I think,
Well,
yeah, go ahead.
I was going to say, if I may comment, the reason why that was such a success was because of the conversations that you and I had with your team on leveraging the out-of-the-box solution. And I'll use the leads area, which I know most healthcare people, both payer, provider, other aspects, don't think of members or patients as leads, but when you put it into the context of Salesforce and you
Yeah,
recognize that there's a whole infrastructure there that's available that's from the traditional sales model activities
that's
called
right.
leads, and it's built around, do you have any information on this person and how are you going to connect with this person? A person may come to you, but they may not be a full out patient yet, or they may not be a full out member yet. How are you going to manage those pieces of information before they become
Right.
a part of your local community? We said we're not unique there. Again, we really questioned ourselves to say we're not unique. And we said Salesforce has a significant amount of functionality and abilities that we want to leverage. And it was
That's
around the leads area. Again, that was different terminology than what people in healthcare like to use, but fundamentally, the information constructs were all there, the solutions and the workflows were already there. We just had to adapt them in a way that made sense. So we changed some headers and we changed some column names. Not a
sure.
major lift comparatively.
Right. Yeah, it's a great call out. I think what's happened is, there's the whole aspect of like facts and overage and just, overall challenges that are there in healthcare. I think one aspect on the patient's experience side, right, is the absence of this white glove experience that people now expect when you go watch a movie or go to a concert or, any kind of other provider. And people kind of expect that level of service, if I may. And I think when you start to think of it, not from a business perspective, but just from a patient experience perspective, bringing healthcare to where the state of the art of tech is, I think that's where that connection is. And so when you start to kind of interact with prospective, your
Mm-hmm.
prospective patients in a way where they go, oh, yeah, this is state of the art. Yes, I'm interested. And it's for their own benefit, of course. So I think, yeah, so that's a great call out. So, all right, so we talked about Health Cloud itself, and I know that you are sold on kind of the vision of the platform and the singularity and all that fun stuff. And I know you've been talking with John about John Carter at Salesforce, our friend, about kind of bringing in MuleSoft as maybe the next thing we're going to be integrating with all these external sources that we've talked about, right? Our grand plan of being inclusive and kind of looking at it holistically. So maybe talk a little bit about the roadmap. Obviously there's Health Cloud, and it's going to have revisions and iterations and phases, and as you roll that out. But then maybe talk about perhaps a little bit about, what are you planning to do with MuleSoft, and what's your kind of future, roadmap, both from a technology perspective and ClinNexus perspective. What are you guys looking to do?
Sure. It's data, and more data, and it's all about the data. And so getting the MuleSoft and the integration, it's all about access to data, and all the customization work and all the other. I mean, there's work to be done. Don't get me wrong, it's challenging to set up these kinds of solutions, but it's also very rewarding, and the state of healthcare integration is improving every day. So, why not try to drive towards more data? Obviously, once you have the data, applying AI, applying new connectivity, extending out to a provider, a new partner solution, or a new partner itself. One of the challenges, as you've noted, that we have to take on is connecting with these third-party organizations like the Food Bank and Smoking Cessation, as an example, or housing organizations. And where we like to look at it is Salesforce gives us the options that are available. They give us the potential options. We don't know which one's going to be right or wrong. We have to meet with them, work with them, and make that happen. But fundamentally, we could do a technical thing. We could actually extend part of our solution out to them as a partner. There's many options that gives us, and that's the thing we like about Salesforce fundamentally, and staying kind of within the Salesforce family, because there are challenges, there are business challenges that need to be accomplished that are much bigger than kind of which technical exact components could actually perform each thing the best,
Yeah, and I've obviously done this for a long time, and typically the answer is yes. And here are the 5 ways you can do it. By the way, let's try to. It's not even just the fact that there is something available. There's typically more than one ways that are available to do. Whether it's connectivity or reports and dashboarding, and now there's a generative. There's some exciting new stuff. Prompt Studios is just coming out now, and there's other things that are coming out that allow us to do. Again, data. Once we have the data, there's a lot of more, additional fun things that we can actually kind of keep on doing. Okay, so totally exciting. Kind of like towards the tail end of the conversation, maybe perhaps if you can, what advice, would you give to CTOs, other founders of the business that perhaps may be looking at Health Cloud? I mean, we have a lot of customers or prospects that ask us, me, and my team, hey, what should we be looking at? We're looking at Health Cloud. Can you give us your opinion? But you as being someone that's gone through the process and selected and is happy with that choice, any advice for these folks?
Yeah, I mean, obviously, there's no perfect solution out there. Number one, I would start with the cloud always, and that's pretty, I'd say, typical answer these days. It really comes down to, do you want to spend your money on IT things, or do you want to spend your money on business enablement? It's as simple as that. Whether you want to have a fully functioning thing, but getting the business in feedback on real life examples is, to me, is everything. And the more you can get that feedback at both the macro layer level and the micro layer level, and do that as fast as you can, that to me usually ends up with giving you the steerage as to how to move forward, okay, and progress the direction. And so spending money and efforts on those functions becomes the critical things, and not worrying about, did we have the right version of the OS, or did we have all the traditional IT stand-up scenarios, trying to minimize that as much as possible. And whether this platform is perfect for everybody, of course it's not, but it's very utilitarian in that it can, you can go from, if you accept the out-of-the-box functionality, which, as noted, we've tried to do as much as we can, you can really go from no services to an operational solution in weeks and days sometimes. Okay, so I think that becomes a real potential driver for people to understand that that's very valuable. And again, even if that ends up with a partial solution, but it gives you insight as an organization as to how you want to progress at a more detailed level, that can save you extensive amounts of money and time in there. And the other question I'd ask them is, same question we asked ourselves is, are you really that unique? Okay. So it all maybe a slightly different way. We've picked up on a phrase that we've been using, and we're calling it progress at the speed of trust. Okay. And really,
I like it.
We want to provide the IT team want to provide to the clinical and business teams some level of trust. They have a hard time looking at Word documents and models and Excel spreadsheets and figuring out that trust. But if they look at the system, they can think through how it's going to work. They can think through what's the reality going to be. And that builds that trust. And then that trust is then conveyed to our partner organizations that we're working with, as the payers and the providers and the community organizations. So that trust exudes from them to those organizations, and we're seeing that positive response back.
That's great. Okay, well, talking about trust, I will ask you one more question, which is, way back when, if I, stayed in Marty McFly's, time machine, fly back some months, right? You had, I remember having this conversation when our introduction was made, that you had an option of picking up obviously several partners of Salesforce, and we're both humble and excited that we got selected in your due diligence. Obviously, you guys do your your due diligence process. We just heard. So maybe just talk about how the experience has been in working with the Accelirate team, and any feedback that you may have for us.
Sure. Well, first and foremost, you're easy to work with. Many organizations find reasons to create barriers, okay, or find reasons to slow things down. So you're easy to work with, and the Accelirate team, I find, is very knowledgeable about the healthcare practices, not just Health Cloud, but I want to be very clear about that they understand the healthcare practices and functions at a basic level, that I'm not having to explain to them what a provider does and what a payer does. And they're actually bringing forward ideas on how to solve things traditionally that you run into when dealing with these types of organizations. And so not having to start with, I'll say, the generic, descriptions of what is healthcare and how it operates really was a leg up. And then clearly the extensive knowledge of understanding Health Cloud and how it connects with the rest of Salesforce and how it connects with the rest of the healthcare community is really valuable to us. And we leverage that, and that's why on several occasions we say, here's what we're looking for. We want your advice as to how to do that, not just from the out-of-the-box functionality, but your advice as to what makes sense from a business solution perspective. And that's what's been spot on so far for us, is every time we turn or ask that question, you and your team have been able to provide us guidance. We didn't take everything out of the box exactly how it was said or done, but we took it with real forethought and really wanted to make sure that we're driving towards those answers, and it's worked out very well. So thank you very much.
Amazing. It's our pleasure working with you. The feeling is mutual. Thank you very much, Matt, for your time. This will conclude our conversation this morning. I think we should do another one, perhaps a few months down the road, when some of this other stuff has gone out and live, and see how the rest of the kind of system is kind of rolling out for you. Thanks once again.
Sounds good. Look forward to it. Take care.
Take care. Bye, Matt.
Take care. Bye-bye.